Yes. So it turned out that we just came to know that now they are pulling doctors from other services back to the COVID floors. Uh, how is your situation, Waqas? Your university, how are they tackling this situation?
So situation in Ohio is overall is not that bad, but I think just this morning we got an email that our gastroenterology people have to help our internal medicine and hospitalist group. So they asked for a couple of tiers. So they made like 4 tiers. People who have worked in ICU, they are tier one, and people who are comfortable doing medicine floors, they are two and three. So probably for few of us are going to be pulled for, excuse me, next week and the week after. So probably they are being a little preemptive and proactive, which is okay. So, but still in the hospitals, I don't see much influx so far, as we have seen in New York in June, July, May, and June. Yeah.
I think back in April, if we go back to March, there was a time when New York was badly hit by the pandemic in the beginning. So third-year residents were pulled from elective rotations. They were supervising junior resident. Is that kind of situation you expect happening or not yet?
I'm not. We are not there yet. I think in New York or in the April, whatever United States has seen, that was actually one of the worst Aprils and May. But I don't think this second wave is going to be that. So far, we don't have any influx as we have seen in the past.
And if we go back, April, May, early, there was a lot of discussion about what kind of PPE, how they, should respond to new admissions where we don't know whether the patient is positive, negative. How is your experience so far with the procedures in GI? Because, you get the consults from ER, patients coming in, hypotensive, need emergent endoscopy, something like that. Right away, they stabilize. How is the situation with the testing right now in Ohio?
So, as we have learned from our previous experience in our first wave, so there are a lot more testing centers now, and now we are not experiencing the same difficulty because in April the main problem was to convince people that there is something like Corona that exists. But now most of the people actually have seen, they have read about it, they have seen the literature and commercial. So kind of it's at least half of our energy was being consumed in the past to nullify these myths, which are no more here. So testing is good. There are a lot of drive-throughs, and they are like ED everywhere. You can easily get tested. As far as the GI procedures are concerned, so far we don't have any cancellations. We are doing all outpatient procedures, and but let's see because the numbers, as we see on the TV, they're going really high. So, but I can definitely see one difference from the previous wave: the virulence of the disease, the virulence of the infection definitely has gone down because we are not seeing people getting admitted. If they are having COVID, that's probably mild COVID.
Since we are talking about the front line, then I think I must ask you about the GI suite, working with the fellows, nurses, residents here and there. What was your experience of, procedure-related exposure to the infection? Is that happening in your centers here in Ohio, back in New York? What was your experience with that?
So in Ohio, we are not doing any procedure so far for COVID patient because there are not many COVID patient. But if you're asking about the experience in New York, so that was like a terrible experience because there's like a 35% false negativity in the test. So you never know what the patient you are doing procedure for a GI symptom. That can be a COVID symptom because 10% of the COVID patient they have diarrhea and 2.5% of the patient they come with abdominal pain. So you might think that you are doing endoscopy for a PUD or ulcer, but actually that might be underlying COVID. That actually has happened. That once we did the procedure, and they first every patient got tested. We did the procedure, we never found anything, and after the procedure a few days later patient developed the respiratory symptoms, and now they developed COVID test positive, which was negative before. So what that means, people were exposed.
I got it. Now, considering that GI is a consult service and you are not only treating the patient, but also teaching the residents and the fellows, uh, what do you think? What impact has this pandemic been on, on the teaching aspect? As the whole idea was to minimal exposure to the patients, and that definitely limited the number of teaching opportunities on the bedside. I know there may be some alternatives, but how is your experience with that? Uh, Other means of teaching the same thing with limitations.
Hey, if you are asking about teaching about COVID, that definitely has gone
Yeah.
high. But
No,
yeah,
I
because
was
this
not.
is everyone started learning about COVID, and there was so much literature being published. Even some of the literature was substandard, but everyone was reading about COVID. But I agree with you. The real teaching, the teaching about other diseases, and the student and resident teaching definitely gone down, because even now when we have a COVID patient and we do concerts, so if we are a team of 4 or 5, I actually prefer to go in because I have already been exposed in New York. So I kind of the other team members, they are reluctant and we don't let them go in. And what that means, bedside teaching definitely has been affected. And it's not only the bedside teaching. I think there are many aspects of healthcare which have been terribly affected. All the outpatient care was affected. All screening colonoscopies they got delayed. Although COVID introduced a new tool to us, telemedicine, but even telemedicine is not easy thing because most of our patients don't really do very good with these laptops and these applications. They are not really uh, very friendly, patient friendly, especially people, elderly people.
I see. As far as we are talking about frontline workers, it's not just about the physicians. The hospitals work, uh, and so, it's just a combined team effort by the nurses and other assistants. Working on the COVID floors, I know you had the experience where you were volunteering on ICU. How did you find them? What were their spirits in the beginning and how they're doing now? I heard a lot about burnout. What's your thought about that?
No, burnout was really something where that is very significant. We lost 2 nurses when I was working in New York. One nurse in ED and one in ICU. I think, yeah, we lost them, and we lost one neurosurgeon in the previous hospital. So that thing really impacts the even one death in a nursing department impacts the whole nursing department, and they get scared. Most of the nurses were elderly, 50 plus, and they were actually not very comfortable. And the burden was high because all the nurses, the most exposure is for nurses. They go like 5 times a day. They get to check the vitals, give the medications. They have to pull all the infusion poles outside the room. They were checking vitals only as needed, and they were the ones who were really exposed more than the doctors. So definitely, the stress level was very high. I don't see that happening yet in Ohio or Ohio State University because, as I said, the influx is not very high. But definitely, if you're asking me about experience in New York, stress level was high in nurses, stress level was high in residents. They were fatigued, they were sleep deprived, and even every other person I know they got sick, and even one resident getting sick that creates a panic in the whole class.
Yes, now talking about this, minimal exposure with the patient, this whole new era of telemedicine jumps in. I know we were trained during our residency, it was more about bedside clinical encounters or in the clinic face-to-face encounters. Now, this is a whole new challenge that how to deal with the patients with the telemedicine. How is your experience with the telemedicine and providing care as a frontline worker so far?
In outpatient, we saw many patients as telemedicine. The first problem which I experienced was the connectivity. Many people, because there are only a couple of applications which are officially allowed by the hospital. You can't just call from your phone like that. There are like Doximity, some other apps. So you have to really tell the patient ahead of time. Then patient has to sign up. Then you have to do video call. I know physical exam is a dying art. It's no more being used as much as we used to use in our medical school. But still, when you see the patient physically, that makes more your exam or your history taking skills a little bit more descriptive. But on the other side, if you see the positive aspect at the same time, there are certain diseases like colonoscopy screening And a colonoscopy screening, you're talking about the rest of the interval. You really don't have to see the patient. So at one time, this is a downside which I just talked about. But again, the plus side was people were getting early appointments because they don't have to physically come, and you don't have to actually wait only for the clinic day. You can actually do your telemedicine visits in between your procedures as well. So this was something new which COVID introduced to us.
And being on a front line, in the beginning of the pandemic, all these hospitals were facing this challenging of personal protective equipment. How is the situation now? What do you think? We are, very well aware what to do, what kind of exposure we need to be, well aware of. What is exposure actually? Those are like basic information. Do you think people are well aware of, or as the pandemic prolongs, I feel that people are just kind of bit lagging back. They're saying, oh, we know this thing, so they're not that cautious. How is your experience with awareness of PPE and provision of PPE?
I think there are enough PPE now, as we are all we have been exposed. We have seen how to deal with this. I don't know about the other states, but in Ohio, everyone is using the PPE, like the mask when they go in the public. In the hospital, we see them using the masks, and they are maintaining social distancing, and that, like, they are following really good all the instructions. So definitely this is the blessing of the first wave, that people now actually, because many people, almost every family, they have one or two relatives or family members who have seen this actually happening. So now they, when you see, you believe. So I think they are more aware now.
Now, when talking about the frontline providers in US, it's totally different situation when you talk about the situation in Pakistan. There were many situations, very young, house officers, they were so much exposed to it. And one downside is that people follow the doctors that, oh, if my provider or doctor is doing that, then I will do it. But I see there were like many careless events where the residents were just sitting together in a room without any masks on. They were getting sick. What would be your advice to the frontline care providers, particularly in Pakistan, where there's not that much of testing environment with that? It's not an environment. It all depends on how is the environment, if they are strict. So what will be your advice to the frontline workers, particularly
I
the
think I would say the pandemics are not the seasons. It's not a summer season that it is now in August, summer has gone. It's not a winter season that February has come, winter is waning. It is a pandemic. That's why it's called a pandemic. Every country is involved. It has to be, the mask has to be a part of your regular day dress. As you wear shirt, trousers, ties, you have to actually put a mask. You can make fancy mask, that's fine, but mask has to be the main thing. It's like the biggest protection available, easily available. We don't have that excuse anymore, that there's a shortage or there's crisis. Everyone, until you are damn sure, until a central authority, which is WHO, has announced that we are out of pandemic, every person has to wear a mask. Because I have seen, in working in New York, I have seen terrible cases. I have seen young people dying of. I still remember a couple, like a 35-year-old guy and 32-year-old girl, and they were like married actually, and they were admitted, and one of them actually died, and one of them survived. So it is a myth that it only affects elderly, and protection, prevention is the main cure until there is clear evidence that we are out of pandemic. So some people I have heard saying that we have not seen, so we don't believe. I pray you don't see it. That's my thing. You are lucky that you have not seen it, and I wish you don't see it, because it is terrible experience to gasp for air. And in one night, I have seen 13, 14 people going from room air to ventilator. So we used to carry like small ventilators, and we used to actually carry from floor to floor. So that is the biggest advice, and that mainly applies to doctors, because when doctors follow, their patients follow. And you and Faran, you and me, we have done so many programs about COVID awareness in the past as well, in Urdu language, English language, that people really have to believe it. You really don't want to see it to believe it without seeing it.
Definitely, those are great words, great advice. Dr. Shafi was recently in Pakistan, right in the middle of pandemic, and he was able to get in touch with, many of our young colleagues who are right now on the front lines. I just want to know about his experience. What is the understanding of this pandemic and our young physicians back in Pakistan?
Thank you. I rather late some technical issues. Fortunately, when I went to Pakistan, the severity of it was not as bad as it was in America. And to answer this question, I think there is a shortage of PP in every part of the country. And we as a foundation, we were recognized that, and we on a very smaller scale did some fundraising and provided some PPs to young physicians teaching hospitals. But to answer your question directly, I think there is very good awareness among the young physicians, that they have to be PP, they have to be proper, wear the proper gearing equipment. Though in a very chaotic way, that's our foundation has been advocating from the beginning for so many years, wearing N95 masks when you see tuberculosis patients, wearing gowns, wearing gloves, but we feel that this pandemic has brought into attention how important it is, to be properly prepared, wear protective gear when we are seeing these highly infectious, contagious diseases. I think the evidence in Pakistan has gotten better. Um, I think we have not seen as bad as other parts we saw. If it has been the case, I think the condition would have been much worse because of all this, so much information which is available now. I think Pakistan physicians are really glad to tell they have been dealing with it in a very innovative and very responsible way. I've seen everybody's now who are dealing with this. They wear proper gear. As a matter of fact, we in America are not wearing all those gowns. When we go to see COVID patient, we are wearing N95, the shield or the surgical mask. But in Pakistan, I think the young doctors see they have this sense of wearing the whole gown, and the whole uh, uniform. But having said that, I think we need to continue educate with this disease, which is so, I think, so new to us in some ways. We have not dealt with this kind of illness in the past. We have read it, and this is I'm learning on a day-to-day basis how infectious, how contagious, how dangerous this disease is. And as Dr. Waqas mentioned, that really our best weapon right now is to wear mask. Wear mask everywhere, and when we see these patients. So while I was in Pakistan, I was wearing my surgical mask all the time, and when I was in places where there was congestion, I was. Though I was wearing N95 also, though it's not indicated, it's only indicated when you see. But having said that, among general population, the use of masks was really very little. I did not see in the crowds people wearing masks. So I would urge people who are listening in Pakistan, please wear masks. Wear mask in some ways could be as good as being vaccinated with COVID. That has been, that has come from CDC even. So don't underestimate the power of mask. This disease is deadly. This disease is very contagious. And as we speak right now, mask is only our weapon against this disease. Thank you.
Great messages, Dr. Shafi. So, what looks like, even if we go back pre-COVID and talking about the workup of respiratory illnesses, talking about respiratory viruses, I don't know how much the frontline force was well aware to how to diagnose. I mean, here in US, when we talk about respiratory pathogen panel PCR, so I know the frontline people are fighting and they're trying to treat this patient. At the same point, I think this is one of the learning opportunities where we can see that, it's so much to learn about these respiratory viral infections. We put everything on a bacterial pneumonia and then treat it like that. So I think it's one of the biggest learning opportunity as well. Now, having said that, being on the front lines, I want to go back to Waqas and see, dealing with the families. There were many instances where patients were on quarantine isolation in the hospital, very sick, critically ill, and families were not able to go in due to all these limitations and prevention. What was your experience being on a front line, talking to the family, listening to them, and sharing or breaking the bad news? What was that?
Okay, I will be very brief while answering this question. I think we are over our time. I think the biggest problem which I faced, or I think other people might have faced, was this disease was not predictable. Many people used to ask us why he got, why I did not get, and what are the risk factors. And there were so many myths. It was so new disease. Literature was like coming, overflowing, and we did not have any set policies how to treat. ICU was treating different way. Floor was treating different way. Somewhere steroids, somewhere eculizumab, somewhere remdesivir. So every patient, every hospital has a different protocol. We really did not have best way or best answers to their questions, that why my family member in another hospital is being treated differently and this patient is being different. So first of all, it was new, data was different, and we didn't have medical answers, honestly speaking. Maybe we don't have answers even yet, because still the data is overflowing, but at least better than before. And the second thing, you really don't know if it is pneumonia, because many time I have seen people superimpose pneumonia after a COVID infection. So it was somewhere hard to convince them, like if it is pneumonia or if it is a viral pneumonia. And if the patient is false negative and then got pneumonia, we still used to tell them that it is COVID because there is lymphopenia, white count is low. They used to say our lab is negative, because COVID was such a big stigma in April that no one was ready to believe that it was COVID. And another problem which I faced was the goals of care discussion, because many people 70 plus, we try when they had bilateral pneumonias and ARDS, we try to convince the families that its outcome is so guarded, so bad, that we don't recommend going on ventilators, because being on ventilator means tracheostomy and then another like few months. It was hard discussion. It was not at all an easy discussion, because people were still digesting this information. So few people didn't believe. Few people said it was negative. Still, why you are saying it's COVID? They don't know what lymphopenia is. How you can tell them? And then people were asking why our patient is being treated differently as compared to other hospitals. So I would say this, and I think other people might have had the same experience. So up to you, Faran, and we have to see if I think we are over time or not. But if you guys are asking like one advice, as Dr. Shafi very rightfully said that we have no vaccine, but only vaccine we have right now is the mask. It doesn't cost you, and it actually looks good now because it's a part of your personality for the last 6 months. Even you can't unlock your phone. Many people are actually taking picture with the mask and using it as a code to unlock the phone, because they keep, and that's fine. So wear mask, and believe it, so that you don't have to see it. Don't say I haven't seen it, so I don't believe it. Believe it first, so that you should see it. Yeah. So I would
I
say,
totally agree with you. Yeah, I totally agree with you. And one other thing is, we talk a lot about exposure. Being on a front line, we may be exposed every day, and our families are back home. Even if they are staying home, one of the most key, I would say, the key thing is, when we go back home from the hospital, there's an equal chance that, who knows, we may be a carrier, right? So it's not about just us wearing masks while at workplace. It's an equally high risk of going back home, taking the virus with us, and infecting poor people who are just staying at home and staying away. So that's equally important for all the frontline workers. Because I had seen many such incidents where, the same mask who they were using in the hospital getting contaminated and then taking it home, right? And then I know there were big limitations in the beginning for the frontline people. They didn't have that number of masks and all N95, but that would be another big precaution, that if something you feel is contaminated, infected, or white coats, I just put my white coat back here. So I know it's a trend there back home. The people carry their white coat all around. They carry white coat in the markets, all that stuff. It's one of the educational point for the frontline people that are these things are contaminated. They should not go home with us and contaminating the whole environment. So that's one of the key things for the frontline worker to get themselves ready to face it, not for their own, but for their close, family members.
Yeah, I think with this we will wrap, and thank you very much for arranging this. And I think if we are going into second wave, we'll do more sessions. And this foundation is doing a great job. And thanks for inviting me. And very great. I know all these people. I have worked with Dr. Shafi, Dr. Ahmad. Great people. Keep spreading the awareness because this is Sadka Jari. Okay.
Okay, thank you very much, Waqas. Thank you very much, Faran, for being part of this mission with us to educate. As you know, the motto of our foundation is prevention is better than cure, and we will continue to spread this message. And we thank you for spending your time for this important discussion. Thank you all.
Thank you,
Take
Dr.
care.
Thank you for the opportunity to talk to you. Thanks.